They pounce, they explore. What happens when your pet's world begins to blur? There's Their life can change in a blink of an eye. Today, we're taking a closer look at your pet's eyesight and what you can do to protect it, as well as answer your pet related questions on this episode of Ask the Doc, No Appointment Needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health-related questions. I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and today we're going to discuss what you need to know about taking care of your pets when they have trouble seeing. All right, let's get started, guys. Our first question is from Lanai, who reached out through us through our website, allhealthtv.com. Hello, Dr. Carter. My dog's eyes are starting to look a little cloudy. They can't get cataracts, can they? All right, so this is a very good question. Actually, dogs can get cataracts just like they can in humans, but there is something else that can cause a dog's eyes to become cloudy, and it's something called lenticular sclerosis, or sometimes we call it nuclear sclerosis. Basically, it's an aging change of the lens in dogs' eyes. It doesn't mean that they cannot see. Typically with cataracts, when dogs have very mature cataracts, they really cannot see out of that eye or eyes at all. When they have lenticular sclerosis, it's kind of like a little bit cloudy, almost kind of like, think of it like when you're in the shower and kind of like, the glass and stuff kind of fogs up a little bit. So their vision is a little bit construed, but they're still able to see stuff. If you are concerned about the fact that your pet might be developing cataracts, definitely want to make an appointment with your veterinarian, okay? There are a lot of medical conditions, in particular diabetes, which can also cause cataracts in humans, is one of the number one reasons that we see cataracts develop in dogs. And there is actual surgery that can be done for cataracts. Now, it has to be done by a board certified ophthalmologist. And yes, we have board certified ophthalmologists, in veterinary medicine, which is great. But there is a surgical procedure that they can do, okay, to try and get rid of, the cataract. Sometimes, if it's a very older pet, they're not safe to be under anesthesia, different things like that. I mean, they still can live a pretty normal life, even if they develop cataracts, are able to eventually kind of learn there and feel their surroundings and be able to get around. But I would say the majority of dogs and cats that I see that are older, they have lenticular sclerosis, and it definitely does cause the eyes to look a little bit cloudy, but they are still able to see. So if you have any questions, please take your pet to your regular veterinarian and address those, and hopefully he or she can help you out, okay? All right. Our next question is going to come from Daniela, who reached out to us through Facebook. Hi, Doc. I think my 12-year-old cat Tabitha is losing her vision. She's starting to bump into things. How do you know if a cat is going blind, and is there anything that I can do? All right, Daniela. So I'm kind of sorry to hear that your favorite babies may be having some eye issues. It depends on the cause of the blindness, okay? There are a lot of different conditions, including cataracts, that can suddenly, or more kind of gradually, I guess you could say, cause your pet to have some vision loss. Typically, the way we check for it, as far as in a emergency or general practice setting, is we kind of do something like the dazzle reflex. We check for menace response. So we kind of like take our fingers and go up close to the eyes, see if they look. We'll sometimes drop a cotton ball or some other type of object to see if they kind of shift their eyes towards that. The menace response is where we actually take our hand and we kind of wave it in front of the eye. Normally, if you're able to see a hand coming towards your eye, you're going to blink. And that's it's very rudimentary, but it's actually the way that we're able to check for vision. Now, at the ophthalmologist, they have a lot more extensive equipment, and they can actually look deeper into the eye, like back into the retina and different things like that, the anterior, the posterior chamber, to be able to determine that. All right. Most pets that are starting to lose their vision or go blind, they are able to adapt. Okay. Especially if you have an outdoor cat. Obviously, I would recommend maybe making that cat an indoor cat, or maybe having like a smaller area for the cat to roam. But pets are amazing. I've seen so many. I've seen cats actually that had severe conjunctivitis, that we had to take both of their eyes out, and they're able to get along perfectly. They're able to jump, they're able to run, they're able to play. So pets can adapt very well. Okay. Now, there are some other medical conditions that can be a little bit more serious, and there's something underlying that can suddenly cause your pet to lose sight. Okay. In particular, with cats, when they are a lot of times hyperthyroid, they can have elevated blood pressure, and that blood pressure can get so high that they basically can kind of almost like blow out their retinas. Okay. Like the back of their eye, where that's, where vision and everything comes in. Those cats, I've seen a couple of those cats, and they just tend to have really super dilated pupils. You can just like, they look at you like they're staring into your soul, and they have no menace response, nothing like that. Unfortunately, I think cases like that, there's really not much that can be done, but you definitely do need to treat the underlying cause, because if they've got blood pressure that high that causes them to basically lose their vision suddenly, it can certainly have other detrimental effects on other organs in their body. All right. So if you have any concerns, Daniela, definitely set up an appointment with your veterinarian. Okay. He or she may recommend an appointment with an ophthalmologist if they feel like it's something that is a little bit more serious, something that they're not able to treat, or if you want to even go for an expert opinion. But definitely, if you have concerns about your pet vision, schedule an appointment with your vet. All right. All right. We got another Facebook question, and it is from what are our loyal viewers. This time it's from Kyle, who wrote to us through Facebook page. Hi, dog. I have a 7-year-old English bulldog named Munson, and recently noticed that both of his eyes get very gunky with this greenish yellow discharge sometimes. I cleaned his eyes with eye wash and it goes away, but then it just comes back. What could it be? All right, Kyle, I appreciate you trying to help your dog out. So without seeing your pet, it's hard to say 100% what is going on, but I can tell you from personally owning an English bulldog myself, they are prone to something called KCS, or dry eye. Now, KCS, hopefully I say this correctly, is basically keratoconjunctivitis sicca. So it is basically, you have 3 components of your tear film. All right. And obviously, as you know, your tears are what basically keep your eye, your cornea moisturized. It also helps protect the eye from irritation and things getting in it. And obviously, rinsing things away that could cause infection and problems. So what happens when a pet has dry eye is either they're not making enough tears, or either the tears that they are making are not basically adequate. Okay. There's something kind of wrong with that. The way that we check it is something called a Schrimmer tear test. All right. It's literally this little long piece of paper that has like a blue line on it that is dye. We stick it kind of in the bottom part of the eye here, close the pet's eyes, and then we count for a minute. All right. Now, normally with that in the eye, you're going to produce tears. And so that moisture from the tears is going to transfer onto the paper and then onto that dye. And then the dye is going to kind of spread down. All right. And then we look at it when it's been a minute. All right. Normal, tear production in dog's eye should be at least 15. Okay. 15 to 20 millimeters per minute. When you start dropping below that is when there is concerns that we're starting to develop dry eye. Now, specifically, if you have a pet who it only goes to 5 millimeters or less, that is really, really severe. All right. Now, the good thing is that dry eye can be treated. It usually is a lifelong condition. Okay. It's usually autoimmune. And so that means you're going to have to do eye medications for life. The two most common eye medications that we use are going to be either cyclosporin or tacrolimus. They can come in an ointment form or come kind of like in a suspension type form. Other things that we sometimes use is going to be artificial tears, other types of lubricant, just things to kind of put in the eye to keep them moisturized in the meantime. The two medications, the tacrolimus and the cyclosporin, that is what actually helps increase the tear production. All right. And definitely a pet having dry eye can be, it's not good. It's not just maybe causing a little bit of irritation. It can cause a lot of trauma to the eye. I have enucleated eyes or taken eyes out because the pet has such terrible dry eye that literally the eye just dried out and almost became like petrified, kind of like what you think of like a mummy would do. And obviously it can be very, very uncomfortable for them. So, without seeing your bulldog, Kyle, I can't say for sure, but it's very common in English bulldogs. I know because I dealt with it with my bulldog, but definitely just schedule an appointment with your vet. Okay. They're going to probably want to do a couple of tests, including the Schremer tear test. And if that's the case, understand there is some medication you're going to have to use, but definitely they're going to be able to help your pet out. Okay. All right. In case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, our next question comes to us from Juanita, who visited us on Instagram. Hola, Dr. Carter. I recently rescued a kitten from the streets, and I noticed her eyes are red and there's some kind of discharge too. It's a little milky. Could this be serious? All right, Juanita. So disclaimer again, without seeing your pet, I can't say for sure, but based on the fact that you told me that you kind of rescued a kitten from the streets, the most likely thing that I think that is probably going on is going to be conjunctivitis. Okay. Conjunctivitis is basically swelling of that pink part kind of surrounding your eyeball. It is extremely, extremely common in cats, especially kittens that have not been vaccinated or don't have the best immune system. Typically, it tends to be viral. Okay, viruses are the most common cause. You have calicivirus, which is one big one, and then you have herpes virus. Okay, this is a herpes virus. It's a little bit different from one in humans. This is in cats that can cause eye problems and respiratory problems. But yes, it is a herpes virus. You can sometimes have bacterial infections that can sometimes cause conjunctivitis, and sometimes even just irritants, things like shampoo, dirt, grass, like any foreign object can get in the eye. And if the pet keeps rubbing it, they can kind of almost cause a conjunctivitis. But particularly in cats, it is usually viral. So what that typically means, okay, when you take your kitten to the vet and you say, hey, my cat's eyes got discharge, they're really red, he's squinting, blah, blah, blah. They're going to do a couple of tests, okay, to kind of determine that it's not something else. And if those tests come back negative, then more than likely they're going to say it's probably conjunctivitis. All right. Most of my patients, I do tend to give an antibiotic eye drop just in case of secondary bacterial infections, even though the most likely underlying cause is viral. What we typically tend to do for viral infections, no matter what symptoms they cause, is just treat the symptoms and then obviously support the immune system. So sometimes they will, give a vitamin B12 injection. They will start on like lysine, which is a supplement for a person who has like a viral infection, things like that. Conjunctivitis, usually is not a life-threatening condition, but if it goes untreated, like I mentioned before in one of the other questions, I have seen eyes that have been damaged so bad that they had to be taken out. So definitely it is better to bring your pet in early and get treatment started, okay, before it gets to that point to where they lose their vision and possibly may even need to have an eye removed. All right. All right. Thank you so much for that question. All right. All right. So next one comes from Alicia, who reached out through YouTube. Hi, Dr. Carter. I have a wellness plan in my local pet hospital, and part of it includes checking my dog's eye pressure. Why would they need to do that and how often? All right, Alicia. So what they're probably talking about is intraocular pressure check, or also known as tonometry. Okay, so why is that important? So it's important because if your pressures are either too high or too low, that can signal that there is something going on in the eye. Now, in particular, when the pressures are elevated, that is something called glaucoma. Okay, same thing like it is in humans. There's primary and there's secondary glaucoma, which that means is sometimes there's a primary problem with the eye that can cause the pressures to be elevated. And usually that has to deal with what we call the aqueous humor, which is kind of like the liquid portion of your eye not being able to drain properly. Also, other conditions, okay, that affect the eye can sometimes cause glaucoma. Typically like ulcers. Unfortunately, like if you were to have a mass in the eye or behind the eye that is putting pressure on the eye, that can cause it to be elevated, things like that. Now, when the pressure is too low, that can also indicate something called uveitis. And I'm not going to discuss, everything can cause uveitis because that's like a whole nother episode. All right. But there's a lot of different things, and your vet will obviously probably want to do a lot of different testing to rule out things. Most veterinarians don't really check the pressure on regular exams unless there is an issue with the eye. I do know some bigger hospitals, okay, that do it part of their wellness exam. And if they do, that is great. There is nothing wrong with doing it. Literally, they take this little pin, and there's different versions of it. They put a numbing agent in your dog or cat's eye, and they basically go tap this pin on the cornea and go tap, 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 and then it'll give them a reading of the eye pressure. And they usually do that about 3 to 4 times to kind of get an average of the eye pressure. And then that's what it is. Okay. So yeah, it's great that your vet does that. Obviously, if there starts to be any elevation in the eye pressure, catching it sooner versus later is going to be a lot better for your pet, because it's more likely to be able to be treatable. Because sometimes if the eye pressure gets too high, it can cause vision loss and it can cause other things that are irreversible. All right. So great question. All right, we got another question from our website, allhealthtv.com. You should really check it out when you get a chance. It's a choke full of great information. And this question is from Nariko. All right. Hello, Dr. Carter. I think my cat scratched my dog's eye. He's squinting and it's really red. He has an appointment today with his vet, but I'd like to get your thoughts before I take him. All right, Nariko. So I'm going to guess that maybe your dog has got a corneal ulcer from being scratched, okay? Corneal ulcers can be treated, all right? But also they can, if they're left untreated, they can cause very big problems. Think of the corneum basically like the epithelium or the skin of your eyeball, okay? And imagine if someone basically took like a sharp object, not enough to completely cut through the skin, but to make an abrasion or basically leave a mark on your arm. That's kind of what an ulcer is. Now, there are different types of ulcer based on how deep the ulcer goes, because your cornea has different layers to it. Superficial ulcers are the most common thing we tend to see. And that just means, it's like the first couple layers of the corneum have kind of been eroded or eaten away. Those are typically very easy to treat. Usually they can heal completely within a week. Normally you're going to put the pet on antibiotic, eye drops. A lot of times there's other eye medications that help rebuild the corneal epithelium, like that have kind of like hyaluronic acid and things in it. A lot of times vets will sometimes do doxycycline, an antibiotic, and orally, and then a lot of times, medication for pain and inflammation because it's very uncomfortable. Okay. Other ulcers that are a little bit more serious is you can have kind of what we call like melting, or indolent, also kind of known as boxer ulcers, because we do tend to see them for some reason in the boxer breeds. Those tend to be a little bit worse because you can see those a lot of times with the naked eye. With a superficial ulcer, typically you have to do something called a fluorescein stain, and they basically put this kind of yellow greenish dye, like a drop in the eye, rinse it out, and then they kind of take a special light, like a black light, and if they see that it shines or it picks up the stain, then that's where the ulcer is. But with like a melting ulcer, you can a lot of times see it. You can see like a crater, like almost kind of like a indentation in your dog's eyes. And those are a lot more serious. Those require sometimes more invasive treatment. There's something called like a grid keratotomy. We have to sedate the patient, and then we obviously put a numbing agent in the eye, but we basically kind of do like a tic-tac-toe or almost like a checkered board over that area where the ulcer is. The reason why is the epithelium can be very slippery, okay? And when you're trying to grow that hole that the ulcer has caused back together, sometimes that epithelium does not want to stick to the epithelium underneath it. And so you almost kind of have to, like make the surface kind of rough. Think of it like, you've got like really slippery socks, and you're just sliding around on your kitchen floor, but then you get those grippy socks. Okay. And so you're able to kind of like grip yourself and things like that. So that's what the grid keratotomy kind of does. It helps those epithelial cells be able to grip and be able to grow back in. I have seen ulcers that unfortunately have developed into something called a desmetocele. That is very serious. That is where you have one thin layer of corneal epithelium left before your eye will rupture. When that happens, you will see a big hole. You will see stain that will be uptaken around that hole, but where the actual, kind of crater is, it doesn't uptake the stain. And those are very serious, and usually they need to be treated aggressively. And a lot of times I will refer to an ophthalmologist, okay? Because if that last layer of corneal epithelium ruptures, then the dog's eye ruptures. And in those cases, those dogs can certainly, there is some surgery that can be done to try and kind of basically patch up the hole and put everything that kind of came out of the eye back in. But it's very expensive. It requires a specialist, and a lot of times it does affect their vision. Okay. So anytime you suspect that your pet may have got scratched on the eye, has an ulcer, anything just doesn't look right with the eye, better safe than sorry, because I have seen so many times people who waited to bring their pet in, and to the point to where there's nothing that I can do but tell them, hey, we are going to have to take the eye out. Now, the good thing is pets can live okay blind. Nobody wants their pet blind, but they, like I said, they do adapt. Okay. But obviously you want to try and prevent this. Okay. All right. Good luck with that one. All right. All right. We got another Facebook question. All right. And this one is from Sarvesh. Hi, Doc. This may be a strange question, but do cats and dogs' eyes shine in the dark? It kind of looks like that to me. And if so, what causes it? All right, Shrivesh. So that's not a stupid question. Yes, of course they do. I don't know if you've ever seen like a cat at night and you kind of shine a flashlight and then they got those bright yellow eyes. So basically, dogs and cats have something behind the retina in the back of the eye called the tapetum lucidum. It is kind of like a membrane there. And that is what helps them be able to see really well at night. And it also helps catch more light. So when you shine your flashlight on them and you see that kind of glowing, kind of like yellow red color, that is the tapetum lucidum, and that is what causes their eyes to shine, and that's what makes them be so great in the dark, unlike us, which we can't really see very well in the dark. All right. If you've got questions, we've got answers, and just in case you missed it the first couple of times, here's yet another chance to find out where to send in your question.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, so I think I got time for one more question, and this one is from tomorrow from our Instagram page. Shalom, Dr. Carter. This is not about illness or injury, but is a question that's been dogging me for years. Do pets see in color like we do, or is it all black and white? All right, Tamar, this is a really good question. So they do see in color, but they don't see all the colors like we do, okay? They basically see what we call bichromatic, and we as humans see trichromatic. So we have cones, okay, these receptors in the back of our eyes that is what help us see colors. In particular, cats and dogs see mostly like on the blue kind of violet spectrum and a little bit on the yellow and green spectrum, and then kind of also some grayish stuff. So they really can't see reds very well. I know that for a fact, but they do see in color, but something that might look red to us is going to look gray to them. Okay. But honestly, it doesn't really matter, but it's still cool to know. So, all right, guys. Well, listen, I've had so much fun today answering everybody's questions. This was a really cool topic that interests me. And just so you guys know, listen, anything there is about eyes, if you have questions or concerns, call your veterinarian, okay? Because the eyes are extremely important. They are a very important organ. That is what helps your pet see, helps them get around, interact with people, with other things. And the good thing is we have specialists out there. So if there is a big problem with your eye, or sorry, not your eye, but your pet's eye that your regular veterinarian can address, we do have a lot of wonderful specialists in this area that will be able to help us out, okay? Well, I wish you guys a great day, and I will see you next week. Bye.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,